Hi, Mo. Thank you so much for being here with us today. Welcome to our first official live stream at Prevent Connect's LinkedIn. And also, I apologize if you can hear some noise in the background. My neighbor is driving his very large truck away. But, Mo, good morning. How are
Good morning.
you?
I'm pretty good. How are you?
I am doing so well. I'm so happy to have you today. Thank you for making time to chat with us.
Oh,
You
yeah, I'm happy to.
good. You have been very busy this year, Mo. Can you tell us a little bit about what you do first, about who you are and where you're joining us from?
Yeah, so I'm Mo. I work at NSVRC, the National Sexual Violence Resource Center. I'm the prevention specialist there. And mainly I work with people who have the RPE funding through CDC, and RPE stands for Rape Prevention and Education. And my little trivia is that NSVRC is based in Pennsylvania, but I live in Washington State and have worked remotely since I started, since pre-COVID times. So I'm joining you from the West Coast.
Amazing. Two
Amazing.
West Coast kids. I love that for us. I always love chatting with you because I forget pretty much all of our partners are on the East Coast and you and I are over here. So it's a good morning for us. It's a good
Mhm.
lunchtime for everyone else today. So
Exactly.
in addition to all of the million other things that you do at NSVRC, you are one of the big people behind the prevention track at the National Sexual Assault Conference, which is right around the corner. So congratulations on the biggest sexual violence prevention track in the country. That's always so
Thanks.
impressive to me. I keep talking to folks about how excited they are about the conference now that the sessions are out. And, I felt this way as I was looking through sessions. The general theme is I don't have enough time to go to everything that I want. I don't know what to do. And that means that you all have done a really great job.
Thanks. It's a really good problem to have. I feel that way too. I mean, okay, I'll say that the benefit of having more than one thing that you're interested in at a time is that sometimes the rooms get full and then the room monitor will be like, please choose a different room.
Mm-hmm.
So if there's something that is really important for you to go to, I would say get there very early. But yeah, otherwise have that excitement in your pocket in case you need to inevitably switch to a different workshop.
Yeah.
It happens.
I get that. I know. I last year I remember sessions would fill up totally and you had to have like a second and a third choice. They're that popular. So I'm
Hmm.
curious for you, what does it take to put a track like this together behind the scenes?
It's like a little moving symphony of pieces. It's a lot of stuff. I am the person from the NSVRC and PCAR Respect Together side who is, the main coordinator of it, but we always do this in partnership. So Ashley at Valor has worked with me on this. We've done this together, I want to say since 2016, but it's never ever just the two of us. We have a selection group that helps us make final decisions. And we also have a broader review group who goes through the submissions when we receive them because we get so many. So, in terms of putting the track together, there's like multiple hours of reviewing proposals. We have meetings, we discuss things. And I don't know, I have a couple spreadsheets, honestly, that I made up to keep track of like what are the scores from the reviewers, what are the notes that I have, what are the notes that other people have. I color code them. There's a lot of like finagling to make it work together, but I think it's a good process. I feel like it's a very thorough process. We have people from state sexual assault coalitions, staff from there come together with us. People from state health departments, Respect Together staff joins us, and also our CDC partners, in addition to Ashley and sometimes other folks from Valor. So we really have a process where first our main reviewers go through submissions and fill out surveys. we really ask a lot of questions about how well does the proposal meet the objectives of the conference? What skill level is it? How relevant is it to the RPE program? And then the selection group, the smaller selection group, gets the top scoring proposals. Usually I have it narrowed down to about 40 ish. And so then the smaller group gets to review all of those, and we meet on a long phone call that's a couple hours long to discuss and make our recommendations. It's always really fun. It's always a lot of work and consideration, and it's hard to say no to a lot of the submissions because people are so smart out there.
Mhm. And I know it's such a long process too, and it takes so much intentionality as you're sifting through, I think, what, hundreds of
Yeah.
proposals. I know Ashley will sometimes send me the list of proposals to look at afterwards because it's a great way to see what's going on in the movement in the field.
Mhm.
And I'm always like, there is so much here. I don't know how everyone keeps track of everything. I don't know how
Yeah.
you do what you do. And I know that intentionality and values are really important in that work. So I'm curious, what are some of the values that you all were grounded in when you were crafting the calls for submissions and picking sessions?
Yeah. It's funny because I was thinking about this question and I'm like, are these values? I don't know if they're values. We can discuss this. We can see maybe what you think. But the first thing that we do is we craft the submission form, and we really work with our CDC funders and partners to figure out like what are the current needs of the RPE program. That's really a big focus. I don't know if we would say value. I don't know. What do you think? Is this a value? But we focus on like how relevant are things to the RPE program. Does the workshop or the submission incorporate a focus on health equity? That's a really big focus for the field and for the RPE program. We also really look for workshops that cover multiple levels of the social ecology with a particular focus on the community and the society levels. We also look for like, is it a workshop that is created and like buy-in for underserved communities? Is it also a community that we haven't had representation of in NSAC before or in the prevention track before? Are there emerging topics in the submission that are relevant to research or practice? Does it have an anti-racist lens? I think I don't know. I think some of those are values. We really want things to focus on health equity. We really want workshops that are by and for specific communities. We really want people to be able to stretch their learning and also get better grasps of some of the theories that are going on in prevention that we're focusing on, like health equity.
Yeah. I mean, that sounds like a value to me. I know part of it are, part of what you're trying to meet are programmatic needs. And I also know
Yeah.
that NSVRC and Prevent Connect are both committed to being really responsive to what folks are dealing with right now. And
Mhm.
prevention is hard. Prevention's always hard, but it's hard this
It's
year.
hard right
And
now.
it is
Yeah.
hard right now. Yes, it is. I feel like I'm constantly having that conversation. So in this moment, it feels like having values of the sessions being centered on community, anti racist, and focused on health equity are especially important because the thing about the National Sexual Assault Conference is it sets the tone, right?
Mhm.
Like people go to NSAC and they leave being like, this is, I feel inspired to do these things, to focus on these things this year. So it makes a huge impact. And it could be so easy to just do what we
Mhm.
always do. And that's why I so appreciate the intentionality and the values that go into it. With all of that, and now that you have the track kind of set in stone. I know things are still movable, but what kinds of sessions were really important for you to have this year since we are so responsive?
Yeah, this year. I was actually looking back at a conversation that we had about this last year, and I feel like some of the things are the same.
Mm-hmm.
So, one of the issues that people have been facing, I mean, when we're saying prevention is hard right now, I think if people are not clear about what that means, there's a lot of legislation happening. There's a lot of like different things that people are picking up on where funders and people with the powers that be are saying like, we don't want you to say these certain things, or we don't want you to talk about these things in this way. And I think it's something that has been always kind of an issue that prevention folks have faced, but it is a lot more. It's a lot more lately, and so that is definitely one of the focuses we wanted to have. Like a balance between theory and practice, because a lot of people are very creative in the ways that they're dealing with difficulties in prevention suppression. How could we could say it that way.
Mhm.
So yeah, the sessions that were really important to have this year, we really wanted a mix, and I think we did a good job. I feel a little nerdy about some of the things that we're doing. We have some workshops that are organizations kind of showing their work, doing a deeper dive into their own program, which I really like to see, because you can learn so much from like, how did you actually do that? You know, you hear about a program and you're like, that sounds really cool. How did you do it? When we have these workshops, it's like, oh, you can really hear how people did it, what they learned from it. You can pick up what you might do if you were in the same situation, or if you wanted to take on the same work. We have sessions about research based information, which I really like having too. Being able to be in the field and familiar with research is really a nice thing. We also have hands on skills. So we wanted to have a real balance between getting into the theory, right? And then also having hands on skills. I can tell you in a minute about a couple of the workshops that are the hands-on skills one, but also sessions with communities who aren't usually represented. I know I said that before, but I love when we get submissions from people who are like, "Hey, here's our community. Here's what we're doing." Um, it's so it's so great to be able to get that knowledge, but also just be sharing who we are, what we're doing. I really like it.
Mhm. Absolutely. I I agree with you about the research thing. Sometimes I go back and forth. Well, I think I have a fluid relationship with research and prevention, right? That like
Yeah.
it is so important for us to be connected to the research because that's where the new information is coming out. And I think
Mhm.
sometimes research doesn't always have like a really intentional place to reach preventionists in an impactful way, right? Because it's our
Right.
job to take the research and not just regurgitate it to communities, but talk about how we can intentionally use it to put it into our work, right? And
Mhm.
NSAC is such a perfect opportunity for that. So it's really, really exciting. Those sound like some really cool sessions. I know some of those you talked about are already I'm signed up for them. And you're right. I think folks in prevention are very much like, that's awesome. How did you do it? We love an example from the field, and that is one of the best things that happens out of NSAC because we're not up there presenting. People who are doing it are up there presenting.
Mhm.
Um, I'm curious, is there anything new or different from what you've done in the past at NSAC?
Yeah, there's a couple things. I think I'll talk about workshops first, and then there's something else that I can discuss. Um, okay, so this is where I get a little bit nerdy. Two of the workshops are focused on data. I think more are focused on it, but these two very specifically are focused on like, okay, we're in prevention. I don't know. This is a little like soapbox that I get on where it's like all of a sudden prevention has gotten very complicated. Like someone goes to like work at a coalition or work at a local program, and you're not just being asked to do prevention, you're asked to like weave in the public health theories, use data, do some evaluation, do like all of this kind of nerdy stuff. And for the people who are interested, one workshop is going to be about how to use diverse data sources together, how to harmonize data, which sounds so fun. The other one is called All About That Data or All About Data. And it's basically like bring your laptop. We will be doing work. We will use Excel. We will use Google Forms. We will learn about digital assessments. And they're going to be going through like literally on your laptop, which I love. I mean, I
Maybe
don't know.
I
I
need
didn't go to
that.
nurse
Maybe I
school.
should go to that one because
Yeah.
like I was never I'm not very good at that kind of stuff, and I feel like my brain just kind of turns to mush. So maybe I need someone walking me through it. If you go to that one, you'll see me there taking notes. And
With your bring your laptop. Yeah.
okay.
I'm so excited about it. I don't think we've had something that is that hands-on in a long time. So, especially hands-on in the data sense. I think we've had a lot more hands-on in terms of facilitation or building skills in that way, but building
Mhm.
skills with a spreadsheet, very cool. I'm super into it. We also have a session that is focused on prevention in community colleges. And I
Mhm.
love that because I think a lot of people are doing campus-based prevention, but community college is one of those places that's really tends to, I think, be overlooked in this field. So there's going to be a session about that. There is one that is all about law and order SVU, problematic messages about sexual violence. I'm sorry, this is going to be such a divisive wonderful thing because I know in this field there are people who either really love Law and Order SVU or really detest it because of how it can perpetuate some not great norms. But then people who love it are like, this is great because actually survivors are getting justice, and that's pretty
Mhm.
rare. So there is a workshop that is going to be delving into your favorite or least favorite show, Law and Order SVU. There's also a workshop about prevention in the construction industry. Just another
Mhm.
example of like communities that we don't hear from, right? A lot of times people are like, oh, you're talking about like maybe a certain racial or ethnic group or a certain like geography based group, but this is a work based group, a construction based group. Primary prevention and nature as community. So bringing nature into things, which has been a nice focus in this work. A focus on transformative justice and prevention. I mean, this is just a small list of the things. It's such a good selection of workshops, and I think a lot of those are really new for us. So I'm excited to hear what people think. We're going to be doing an evaluation. This is my little reminder to fill out your evaluation when you get there. We like to collect the data for our own future planning and for our funding, but also we really like to send the information back to presenters. So for the prevention track, at least, we'll be trying to get that information back so people can be like, how did I do? I did pretty good. Yeah.
Mo-
Okay. So those are the workshops. Is it
and
exciting?
it's so exciting, and you're
Yeah.
speaking literally exactly to the problem that I just named of like which ones do I go to. I
I
think
don't
you
know. I
named
don't know how you're going to do it.
I, I don't know how I'm going to do it. Poor me. It's really
It's
hard.
so sad.
Um, I think you shared what, seven? And I was like, oh, I want to go to all seven of those.
Yeah.
I just a quick thing on the Law and Order. That's what NSAC
Hmm.
is for, right? Like that is it
Hmm.
is for conversation. And I love when we can bring in media classics, pieces of pop culture, that are they
Hmm.
are divisive, and it's okay that they're divisive, and there can be good things that come out of things and hard things that come out of things. Um I could stop and talk about each one of these sessions, and I won't because I know that we don't have time.
It's so
But
exciting.
you'll see me at the sessions being like, ah, for each one. So that's very, very
That's
cool.
good.
What
You
else
can
is
grab
different this
people.
year? What'd you say?
Okay. Oh, I said you can grab people and bring them into the workshop with you. You can be like, come on,
Perfect.
you gotta come to this. We're talking about Law and Order SVU. I mean, not really grab people. You know what I mean? Like you're in school. You're
I
like,
know.
come
I'll
on,
be like, come
guys.
on, come.
Come on.
So okay, so we've talked about the sessions. That's really
Yeah.
good. There are also some things outside of sessions that have changed this year. Tell me a little bit about that.
Yeah. I think this big one is related to COVID and COVID safety. So last year at NSAC, there were presenters who were like, hey, it's really important for me that everybody wear a mask in here because I am at a greater risk. And a couple presenters were like, I need to present unmasked because of my own like health needs. And they asked everybody in their workshop to mask up, and people did. It was great. It was such a great response. And so one of the things that we were able to build into the NSAC planning this year was that presenters can ask that their workshop be a fully masked session. So Respect Together is buying, I think they're KN95 masks. I sent a link to some that are teal. So if you see people in like really cute teal masks, that was me. I helped get that. I helped make that happen. Um, but yeah, we're gonna have that information listed in the workshop manual, the conference manual, and then also we'll have room monitors who can help like remind people and also pass out masks. The thing about this that I think is really neat is that it's being responsive. It's building in community care, which is something that, you know, in prevention, we're really all about communities and how can we build communities that we want to see and that we want to exist in.
Mhm.
People are traveling by plane from everywhere to come to a conference, and then we're like in this big hotel all together. So it definitely increases risk for people. And there are some people who, even with workshops being masked, still cannot be at NSAC for this reason. But I do feel like it's a step in the right direction to have that additional level of safety for the presenters who want it. So I'm proud
Absolutely.
of that. I'm really happy about it.
Yeah. I'm proud of that too. I think one of the sessions that I signed up for on youth leadership and prevention had
Mhm.
a mask mandate, and I had to sign a thing saying I was okay with it. And I think you're right, because what are we in this work for, right? We're here
Mhm.
for community care and to keep people safe, and it's really important. Like, COVID is not over, and these are huge events. COVID is
Mhm.
going to happen. People are going to bring it. It is no one's fault. And I really appreciate that you're being responsive. You're right. There's no perfect solution, but it's a step in the right direction. And again, it shows that intentionality and those values. So thank you for
Yeah,
sharing and for your work
I'm excited
to.
about it.
Good, good. I'm glad. Well,
Yeah.
speaking of excitement, what are you most excited about for this National Sexual Assault Conference?
I think I don't. I was thinking about this, um, and I feel like I could be like, "Oh, I'm excited about the workshops," or "I'm excited about seeing everybody in their teal masks." But really, I'm excited about the thing that I'm like always the most excited about. I mean, I'm not able to be at NSAC because of all the stuff we were talking about before, but a lot of people I know are, and the best thing is the connections that people form, and I'm always so excited to hear about that. My coworkers come back and they are just like, "Ah, you're never gonna guess!" Like who I met, who I talked to, who I had dinner with. Um, People have like, I don't know, people get their minds blown and they're like, here's a whole new way of thinking about this work. Here's something that I never considered before and now I'm thinking about. And I just feel like there's that big shift that people can go through at a nice big event like this conference. You can have your mind shifted and you can also like meet people and meet your colleagues. And the thing that's been nicest for me, is that, like when you're doing prevention, I feel like you and I are pretty well connected. Like we have our community, we have people who we can talk to, we have our colleagues. A lot of people who are doing prevention work, if it's in their local organization or their coalition, they're like the only one. And this has been a problem that's been happening for like 10 years, 20 years, such a long time. And so when you go to NSAC, it's such a great opportunity to meet fellow prevention folks.
Mhm.
You can talk with people who work in a different way than you or the same way, and you can make those connections so that when you're facing an issue or you want someone to just chat to or collaborate with, then you have your community. So that's the thing that I'm most excited about.
Mhm.
What about you?
Ooh, oh my gosh, look at you turning the questions around at me.
I'm just curious.
No, I agree. I agree. I was just in New Mexico chatting with Jess
Mhm.
Clark from the New Mexico Coalition, and we were saying, oh, we should all get together with this other preventionist that we know from Ohio. We were like, let's all get together and go out to dinner. And it is really special. It's different. I remember last year at NSAC, someone had made, and if you're watching this and you did this, I want to talk to you because I want to tell you how cool you are. But I walked into the main conference room for the plenaries, and there was a little sketched poster on lined notebook paper that said, social for queer preventionists meet at this time, we're going here, right? Like someone
Oh,
just was like, I want to meet other LGBTQ folks who are doing prevention. And I thought about going, but I'm an introvert and I was tired. So instead, I sat in my pajamas in the lobby and watched people come in and out, and you just see actual friendships being formed,
Yeah.
and it's incredible. And the energy, it's a really awesome place. I'm excited to go to Washington DC because we're on the
Mhm.
West Coast. So much. I'm always really stoked. And I have never, because I joined the coalition during COVID, I've never been to a Respect Together NSAC. My first NSAC was last year. So I'm excited to see what
Okay.
you all have in store.
Yeah, I hope you like it. I think people are nervous. People get nervous because it's such a big event.
Yeah.
Um, but everything is like really humming along. We have these regular meetings where people can just kind of pop in and talk about NSAC stuff, and
Mhm.
people are coordinating all of their carpools because we're close enough. I mean, I say we, I'm not in Pennsylvania, but in Harrisburg, Pennsylvania, it's close enough where people can just drive. So people are getting coordinated, all of like the stacks of paper, you have all the stacks of the folders and everything. People are like, okay, I can bring 2 boxes in my car. So it's all getting there. So I'm excited to hear what you think about it.
I'm excited to tell you what I think about it. It's going to be really fun. Well, for anyone who's watching and they're like, "Oh no, I haven't registered for NSAC yet. I totally forgot. I've been so busy. Summer is so busy."
Mhm.
Relatable. You can still register online at the National Sexual Assault Conference.org. NSAC is happening in Washington, D.C., August 14th through 16th. And I know there are some pre conference activities for some folks. If you're one of those folks, you probably got an email about it. If not, I'm sure you can ask myself or Mo or anyone.
Yeah.
But Mo, I'm so grateful for you. I'm grateful for all the work that you do for our movement and for this conference. Thank you so much for spending some time with me on your Monday morning.
Oh my gosh, thanks for asking me. You're so like effusive. I'm just really like, really? Thanks, Janae. It's so nice to work with you. And I just really, I don't know, I love that we've worked together now for a few years, and we have just such a, I don't know, it's so easy to talk to you, and the stuff that you all do is so cool. And I'm really glad that we can always be like collaborators on things. So
Me
yeah,
too.
thanks.
I agree. This last thing I'll say then, because you reminded me of that. I love that Valor and Prevent Connect and Respect Together and NSVRC work together the way that we do, because
Mhm.
I think we both care so much about this movement and we're committed to the same things, and we do things in different ways, right? And the
Yeah.
conference is a good example of that, because we have our different styles that we host the
Mhm.
conference, and it's so cool that the movement gets to experience both of those things. And I think most people don't know that. Like, a lot of several times this
Yeah.
year folks have said, "You must be so busy planning the conference," and I'm like, "Oh
Mhm.
no, no, that was last year. Mo's
Oh
doing
no,
that
we get
this
that
year."
too. Yeah.
Yeah.
We're like, oh no, we're not responsible for that this year. That's someone else.
Well, more like we're like, we get to experience it just like you do. But
It's
I think
so
it's
nice.
yeah, I think it speaks to a teamwork that we have, and like you said, a partnership and collaboration. So I'm grateful for your partnership and collaboration. I guess I will. I'm excited to see it, and just
Yeah.
thanks so much for your time.
Oh my gosh, thanks for having me. This was fun.